If you've ever wondered why you have back pain, keep watching this video. Hey, I'm Dr. Emil Tompkins, and over the last 16 years, we've been helping families grow healthier every day by removing physical, chemical, and emotional barriers to good health. We're going to talk today about why you have back pain. There's a lot of different reasons you could have back pain. We're going to go over 7 of them. The first one we're going to talk about is muscular. A lot of times we can have problems in our muscles. Well, they'll start to get tight or crampy or something like that. And when those muscles cramp or spasm, that can cause pain. Now, that can typically happen because we're overusing. We're working those muscles too hard and we strain them. And as they start to strain, then we begin to feel it. Typically, the way to get rid of that is rest. Now, the next area that we're going to talk about is arthritis. Over time, if the spine especially is not in a very good position, those joints will begin to wear down, and that's a degenerative form of arthritis. As those joints wear down, they'll start to put pressure on other structures, and then we'll have pain. Arthritis can cause our problem. Number 3, ligament injuries. Certain kinds of traumas, whiplash, and that sort of thing can create ligament injuries. And the ligaments are the soft tissue that holds your bones together. And when they are not in the right position or they're stretched out too much, that can create pain. And ligament injuries sometimes can take a while to get over. Ligament injury is another cause for low back pain. Next, scoliosis. If your spine is curved, typically when we have scoliosis, we probably had scoliosis since you were a kid, and that curvature develops when you're growing. It starts to stabilize as we get older, but once we hit about 30, we start to have pain, and once we get to about 50, that scoliosis will really start to wear down. It'll destabilize and create more and more problems in your back, some pretty serious ones sometimes. So it's always good to check it early, but even as you get older, chiropractors can help you with scoliosis. Up next, a bulging disc. When the spine is out of position for a long enough period of time, or we've created some kind of pressure, usually a bending or twisting type of pressure in the spine, the discs that protect your spine can start to bulge. And as those discs bulge, you'll have pain in the back. That pain sometimes also radiates down into the legs, all the way down into the feet. A bulging disc can create a lot of back pain. Next is SI joint problems. In your pelvis, in your rear, you have 2 bones on the side, you have 1 bone in the center. Where those bones come together, the sacrum and the ilium, the SI joint, where those bones come together, that creates a lot of discomfort. And if things aren't lined up the way that they're supposed to, you can have a ton of pain from that SI joint. So it's very important to check and see if things are aligned so we can take care of that SI joint pain. Stenosis. Over time, as things start to wear down, we can experience something called stenosis. And stenosis simply is when you have a hole and that hole starts to close. So in the spine, we have a bunch of different holes where the bones come together and nerves travel out. And so as those nerves are traveling out of the spine, actually in the spine, we have different areas where there can be holes, and I'll try to show you here. So as we look inside this little hole here, if that hole starts to close because of arthritis or something goes out of position, that can be an issue because you have nerve roots that are supposed to be traveling out of there. And if we start to put pressure on those nerve roots, that's going to cause pain. We also can have this hole here where the spinal cord travels through. If that hole starts to close up, again, because of either the spine is moving out of position or we get a bunch of arthritis and degeneration, that creates stenosis. That creates a lot of pain and discomfort. So stenosis, another thing that can cause the pain that you are experiencing. And the last one, it's called spondylolisthesis. Boy, that's a long word, and I don't know how much time we want to spend on that. The word really is important, but what happens is in some people, there's 2 different reasons for it. Either you're a really active kid or we get older and we have arthritis and things start to wear down. Well, what happens is where these bones come together, those joints fail. And where those joints fail, I can't really show it because these joints are good, but let's just pretend that joint failed. If it fails and that vertebra just shifts forward, way forward. Oh, and now I'm breaking everything because it's not meant to do that. But let's say it really starts to shift forward. Let's turn that forward instead of sitting right on top of the vertebra. As that shifts forward, it puts pressure on the spinal cord, can put pressure on these nerve roots, creates a bunch of problems. We don't want that. Spondylolisthesis is another thing that can cause problems in the spine. And as we get older, that thing can become more unstable. That can be a surgical issue. So there you have it. We've got 1, 2, 3, 4, 5, 6, 7, 8. I said we were going to talk about 7. Well, you got a bonus. 8 different ways, things that can cause the pain in your lower back. So it's great to know that there are 8 different things that can cause the pain in your lower back. However, how do you actually even know if you're dealing with 1, 2, or more of those things? You need to get it checked out. Your family chiropractor does a great job of figuring out which of these issues is most pertaining to you, and then comes up with a plan of care, a plan of action to change that. In our office, what we do is we come up with that plan of action, and then along with that plan of action, we then will come up with ways to correct, stabilize, and maintain that so that not only do we get you feeling better, but hopefully get you feeling better for a lifetime. And isn't that what you want? I'm Dr. Emil Tompkins. I hope you have a great day, and we'll see you soon.